In most hospitals, the pediatric ward is a place of healing, a place where the most vulnerable, children, are nursed back to health with compassion, care, and hope. Parents entrust their children to doctors and nurses, believing they will be safe. But in 1991, at the Grantham and Kesteven Hospital in Lincolnshire, England, that trust was betrayed in the most horrifying way. Behind the comforting uniform of a nurse lurked a killer. A woman whose crimes were so disturbing, she would earn the chilling nickname, the Angel of Death. Her name was Beverley Allitt, and in just 59 days, she was responsible for the deaths of 4 children, the near deaths of 3 more, and injuries to 6 others. Her weapon wasn't a gun or a knife, it was trust. Her method, insulin injections, air bubbles, and silence. This is the story of how one of the most disturbing serial killers in modern British history hid in plain sight, and how the truth eventually surfaced. Beverley Allitt was born on October 4, 1968, in a small village in Lincolnshire. Her upbringing was outwardly ordinary. She grew up in a working-class family, had siblings, and attended local schools. But from a young age, Beverley displayed troubling behaviors. She craved attention in unusual ways, often pretending to be ill, exaggerating symptoms, and even faking injuries. Her obsession with medical care started early. Friends recalled her bandaging herself unnecessarily, visiting the doctor frequently, and even insisting she had conditions that couldn't be medically verified. It wasn't long before she gained a reputation for being manipulative, especially when it came to feigning illness. In her teenage years, Beverley volunteered at care homes and later trained as a nurse. Despite poor attendance, questionable behavior, and consistent failure to complete assignments, she somehow gained entry into Grantham and Kesteven Hospital. It was there, behind the mask of a kind and caring professional, that her crimes would unfold. Between February and April of 1991, an unusual pattern began to emerge in Ward 4, the pediatric ward where Beverley worked. Previously a quiet, low-risk section of the hospital, the ward suddenly became a place of repeated emergencies. Children, some admitted for minor ailments, were suffering unexplained cardiac arrests, respiratory failures, and seizures. Doctors were baffled. How could a child with a mild chest infection suddenly stop breathing? Why was a toddler recovering from a simple stomach bug now fighting for life in intensive care? Among the victims was 7-week-old Liam Taylor. He was admitted with a chest infection and had been responding well, until he suddenly collapsed. Beverley Allitt was the attending nurse. Despite desperate efforts, Liam died. His parents were devastated, but at the time, doctors attributed it to natural causes. Then came 11-year-old Timothy Hardwick. He was epileptic but stable. He too suffered a sudden cardiac arrest while in Beverley's care. Days later, 1-year-old Kaylee Desmond nearly died of unexplained breathing difficulties. She was transferred to another hospital, where her condition stabilized immediately. The pattern was chilling. A child would be admitted with a minor condition. Beverley Allitt would be on duty. Then, without warning, the child would suffer a life-threatening emergency. Sometimes they lived, sometimes they didn't. What finally raised the alarm was the case of Claire Peck, a 15-month-old baby with asthma. She was admitted to the ward and placed on a ventilator. When the machine was briefly disconnected for a routine procedure, Claire suddenly suffered a cardiac arrest. Beverley had been alone with her during the brief interval. Claire was resuscitated, but then placed back in the same room. Within minutes, and again while Beverley was alone with her, Claire suffered another arrest. This time, she died. That death triggered a wave of suspicion. Doctors finally acknowledged that too many unexplained events were occurring, and all shared one common thread: Beverley Allitt. Hospital administrators launched an internal investigation. When the pattern became undeniable, the police were brought in. A deeper forensic review revealed disturbing findings: insulin overdoses in non-diabetic children, air embolisms in infants, and physical trauma inconsistent with medical treatment. Allitt had been administering these substances during her shifts. She had altered charts, disposed of evidence, and capitalized on chaos. The so-called Angel of Mercy was creating the very emergencies she pretended to solve. Beverley was arrested in November 1991, months after the final suspicious death. But even under interrogation, she remained calm and detached. She denied everything, refusing to explain the overdoses, the falsified records, the sudden collapses. She simply said she was doing her job. Police, however, had enough to proceed. Insulin levels in multiple children were abnormally high. In one case, levels were so elevated that the lab suspected a machine error until they tested again. Witnesses confirmed that Beverley had been alone with each child before the collapse. Her own notes were inconsistent with the official charts. A pattern of manipulation, deception, and control had emerged. The motive was harder to explain. She didn't benefit financially. She wasn't a sadist in the traditional sense, but psychiatrists proposed a disturbing diagnosis, Munchausen syndrome by proxy. In this condition, a caregiver deliberately causes illness in those they care for, usually to gain attention, praise, or sympathy. Beverley thrived in the aftermath of each emergency. She was often seen consoling parents, rushing for help, or even crying over her patients. To many, she appeared to be the hero, but she was creating the very crisis she claimed to solve. In 1993, Beverley Allitt stood trial at Nottingham Crown Court. The charges were unprecedented: 4 counts of murder, 3 of attempted murder, and 6 counts of grievous bodily harm. Her defense team argued diminished responsibility, citing her mental health, but the evidence was overwhelming. The courtroom was silent as parents recounted their final moments with their children. How they trusted Beverley, how she'd assured them everything was fine, only for tragedy to strike moments later. Medical experts explained the injections, the timelines, the falsified records. Nurses and doctors admitted they'd suspected something was wrong, but had never imagined such a horrific possibility. After weeks of testimony, Beverley was found guilty on all charges. The judge called her a serious danger to others and ordered her held indefinitely in a high-security psychiatric facility. She was just 24 years old. Beverley Allitt was sent to Rampton Secure Hospital, one of the UK's most infamous facilities for the criminally insane. Her sentence life with a minimum of 30 years. To this day, she remains incarcerated. Inside, she reportedly receives treatment for her psychiatric disorders, though questions remain about whether her condition has improved. Some believe she's manipulative even in confinement, feigning illness, faking symptoms, and crafting new lies. She has been denied parole multiple times. The UK public remains firm she should never be released. The Allitt case left a permanent scar on the British healthcare system. A full public inquiry revealed systemic failures, poor supervision, ignored complaints, and inadequate background checks. Despite her troubling history, Allitt had been hired and trusted in a ward full of children. Since then, nursing protocols have tightened dramatically. Background checks became more rigorous. Hospitals introduced more oversight, and the case is now taught in medical and nursing schools across the country, not just as a warning, but as a grim lesson in vigilance. The story of Beverley Allitt is not one of horror for horror's sake. It's a story about deception, unchecked power, and the terrible price of looking the other way. It forces us to ask difficult questions. How did no one stop her? How could someone sworn to care do so much harm? Allitt didn't fit the image of a monster. She was young, quiet, even compassionate in public. But beneath that exterior was someone capable of betrayal at the most intimate level. A nurse harming children as their parents stood helpless. More than 3 decades later, the name Beverley Allitt still chills those who hear it. She wasn't just a murderer, she was a nightmare in a nurse's uniform, a reminder that sometimes evil wears a smile.